So I want to introduce to you Dr. Thompson. She is a UPMC family medicine physician. She is all about treating the root of the problem. She is a graduate of Lake Erie College of Osteopathic Medicine, and there she studied the holistic approach to healthcare. Her specialty is in reversing disease through diet, exercise, and lifestyle changes. So welcome, Dr. Thompson.
Thank you. The title of this really is Meditate, Not Medicate. So we as a society cannot actually afford to be sick anymore. A patient just told me today that they had to pay $600 for their medication when they went into the pharmacy. It used to be that your medication was free. Then it went to your medication was $5 for your copay. Then it went to $30, and now it's you pay for your medication. So we can't afford as a society to be sick, and there's a physician shortage for sure, so you can't get into a doctor as quickly as what you may want to. The other thing is all this time, doctors have been doing medicine the wrong way, and I don't even think that they knew that. That was just really the way we were taught as physicians. We were actually taught that here's hypertension, here's the drug, here's diabetes, here's the drug. So no disease that can be treated with diet, exercise, and lifestyle changes should be treated any other way. So medications have so many side effects. Actually, 106,000 people die per year from medications. And medicine has its place. I always say, actually last week I had a girl with a liver abscess, a 23-year-old, and thank God for antibiotics when I need them. But antibiotics aren't for every cough and cold, just like diabetes medicine is not for every diabetic. And it's also really important that you understand that your doctor cannot care more about your health than you do. You come to me for guidance, you come to me for some advice. I can't do all the work for you. I can't go home and do it. I just tell you what I would suggest, and then you have to do that yourself. And I'm your biggest cheerleader, really. And that's what every physician should be. And really, you should be looking for that in your physician and ask them to be that for you. So stress can either cause disease or it can actually worsen disease, and that's what we want to start to talk about today is stress reduction. So you are the one with all the power in your life, not the physician. You're the one that has to come to the physician and decide that you're going to work with them and be active in your care. And I also think that it's really important that you realize how brave and strong you are for just showing up, because it's hard to show up to an event like this and not know what we're going to do to you. I once had a patient tell me that if he would have known his life, he was going to live this long, that he would have taken better care of himself. And I thought to myself, well, you know what? Geez, here we are on a boatload of pills, and we can't really get off of those medications at this point because the damage is done. So, we only get one life to live, and we have to make sure that we take care of it. And we don't want to make excuses. You don't want to say that I'm too busy. I have to take care of my spouse. I have to take care of my kids. I have to take care of my grandkids. Really, the most important thing that your spouse, your kids, your grandkids want is for you to be well. And that's true about me. If I don't take care of myself, I'm not going to be able to take care of my family, my friends, my patients, all of that. So I really have to take care of me. So I practice what I preach. All the things that I bring to you, I do with you. This is my mat. So I will be in meditation with you tonight. So overall, the thing that it's something that we really need to think about is that we as a society are overstimulated and we're overscheduled, and we need to learn to take more time for ourselves. And so we need to learn to nurture ourselves just like we nurture everybody else. Really what we need to learn to do is take periods of time where there's nothing on your schedule. So we need to be a human being and not a human doing. So when we're in meditation, we're actually just being, and we're just breathing. So why meditation? It decreases stress. It actually can improve concentration and help with things like attention deficit disorder, learning disabilities, things like that. It can lead to a healthier and happier lifestyle. It helps you to increase self-awareness. It also improves the aging process. So 5 minutes a day, just 5 minutes in your day, if you implemented this, it can actually improve and change your life. But mindfulness, being present, is also very important because it helps you to realize that everything is going to be okay. So when I teach my patients mindfulness and meditation, I say, don't think about the past because the past is depressing. Don't think about the future creates anxiety. Really just think about the current present moment. And that's mindfulness. And so the present moment right now is we're all okay. Right now, deep breath in through your nose and let it out. And again, deep breath in through your nose and let it out. And so just by doing that, you feel just a little bit better, and you can do that wherever you are, whenever you need it. So mindfulness and being present is important. Quieting your mind, finding clarity. That's where I have my best ideas, is when I have clarity, because I have no distractions. People aren't coming at me. I actually go to yoga on a regular basis because that's where my phone's not ringing, and I don't have people asking me questions, and I can just go and breathe and be that human being and not that human doing. And again, it gets easier. So meditation is helpful for things like anxiety, depression, attention deficit disorder, post-traumatic stress disorder is huge. Actually, after Joseph's first program, a young girl came up to us after and said that she had been a victim of human trafficking. And she was a young girl. She was probably only in her early 20s. And she actually said it was the first time since that had happened to her that she actually felt a sense of peace and calmness, and she was able to feel safe. So there's something called neuroplasticity, which is brain retraining. So your brain is wired a certain way right now. It used to be thought that you couldn't change that you were stuck with that brain forever. Oh, I have a chemical imbalance. I can't do anything about it. That's in fact not the case. Your brain can be changed. Just like you can build your bicep muscle, you can change that. Do some people need to be on medication for life? Absolutely. Do they need to be on 12 medicines? Probably not. Meditation is important for that, and it's also important for cancer, oncology support. Insomnia helps you to sleep better at night. It is helpful for irritable bowel and GERD, because a lot of those conditions are inflammatory. So the people, if you have that condition and you're going through this meditation tonight, focus on that area and try to feel like that area is relaxing. Hypertension is a big one that meditation can help, and that's because it helps to lower your blood pressure 20 points. I've been successfully able to get many people off of medications by just teaching them to breathe. It actually can also lower heart disease, as well as decrease the risk for myocardial infarction or heart attack or stroke by 50%. That's huge. And that's, again, because a lot of these diseases are stress-related. It helps with people with things like MS, chronic pain syndromes, fibromyalgia, and also visualization, like I was just talking about. So if you have a chronic pain area, imagine that just relaxing and melting and all of the pain going away. So you can do things like guided imagery and stuff like that will actually it really will help. And so another focus of mine is kids. And so I've done kids yoga, kids meditation, and that's important because we are bringing up a stressed out society. And so they look to us to be the leader. And so you can implement some of these things even in your kids, your grandkids, and start early with them. You can do walking meditation. So there's many different forms of meditation that you can implement. There's things like Tai Chi, Qigong, energy movement. That's what we're doing tonight, is we're showing you the way. And you have this tool to use forever. So what I hope for you is that you get this same feeling that I got during this experience, and you know that this exists within you, this state of relaxation, this place of peace, this something that you've never really felt before, this sense of opening and just melting into the mat, this sense of being protected, and nobody's bothering you and nobody's getting at you. Once you feel that once, you can go back there. Somebody just asked me the other day, so why are you doing all this? And I said, well, because I believe that I can change the world and make it a better place. And I believe all of you can do that too. And I'm going to turn it over to my dear friend Joseph, and I'm going to let him talk a little bit before we go into meditation.
So I started my practice 14 years ago in Portsmouth, New Hampshire. The instrument that I play in my practice is the didgeridoo. Little background on the instrument as far as it pertains to sound therapy work. There's 3 basic ways that it affects a person. So the first is that it's producing sound harmonics between 0 and 1,000 hertz. Your 0 to 125 hertz range, that's the same frequency of sound if I put a candle out on the floor and I went, the breath would flicker the flame, but it wouldn't go out. But if I start to play, and I push down that really low frequency, below 125 hertz, you can actually snuff a flame out on a candle. So that's infrasound, super low and audible. And if you go up to the ultrasound, which we've all heard of ultrasound, so super high and audible, they use that for medical imaging, stimulating bone growth, for in cases of breaks, fractures, bone surgery, relief of muscle tension, muscle knotting, all of those physiological applications of ultrasound. The opposite end, that infrasound end, you can also use infrasound to produce similar results. So that first way that the Didge affects a person, it's very physical. It's considered a no-touch form of sound massage. The second way that the instrument affects a person is through the energetic. So the subtle energy system from a holistic perspective, and there's a couple overlaps. So you have traditional Chinese medicine on one side, and then you have Ayurveda, which Ayurveda, more commonly, if you're familiar with yoga falls into the Ayurvedic system of subtle energy work. The traditional Chinese medicine system focuses very sophisticatedly on individual organ center. In that system, there's no direct note or key from a musical standpoint for those energy centers, or those organ centers. But in Ayurveda, you have the 7 energy centers, the chakras. First chakra, safety and security of self and family. That would be the key of C. Second chakra, it's relationships. That's the key of D. Third chakra, self-esteem. That would be the key of E. Fourth chakra, heart chakra. Key of F. Fifth chakra, throat. Key of G. Third eye, A. Crown, B. So you're able to go up the energetic system just like a musical scale. Actually, for those of you who are musically inclined, you'll notice that was just a C scale. So that's the second way that the instrument affects a person through sound, is you can apply sound in a similar way that you apply acupuncture needles to clear out energetic stagnation inside the subtle energy system. And you'll see similar results as what you see with, say, 5-element acupuncture. And really any energetic application to the subtle energy system, you're looking at a 10 to 14-day window of energy movement. So that's that second application, essentially a no-needle form of sound-based acupuncture. The third way that the instrument affects a person is through the meditative. This is the most important thing that the Didge does. I don't consider myself to be a healer, and I don't think of the didgeridoo as a miraculous healing instrument. What it does is creates a sound that holds an envelope of space where people can get into meditative states. So that's the third way that the instrument affects a person, again, is that allowing you to have that quick and easy access to the meditative.
You can close your eyes and begin to go into your breath. We need to take responsibility for our health and wellness so that we can show up in our lives empowered, committed, authentic, and loving toward each other and our world. Today, let's make a genuine commitment to our health by choosing foods, beverages, and products that heal and nurture. Let's honor our planet by not contributing to the waste and abuse of its resources. Let's let go of limited beliefs, old habits, and addictions, and open instead to new ideas and information that nourish and inspire our body, mind, and spirit. Let's have the courage to regard each other with compassion, respect our own journey with patience, and live every moment in gratitude. And that's by Sean Korn. Today, remember to create a life that is worth living, one you can be proud of, and one you can be grateful that you have lived. Thank you very much for your time. Thank you very much for showing up. And please take what you learned and share it with the world, and I hope to see you again.
Thank you.